So that will be all for physical examination. And Sandra, regarding the symptoms that you told me about, you said that this abdominal pain has been annoying you for a month, right?
It has been so annoying for a month.
Okay, for a month. And you also told me about having diarrhea, and this diarrhea had an onset quite near the also onset of the abdominal pain. But you specified me that this diarrhea came with a not so red, some kind of browny blood 2 days ago, and that all these two symptoms are accompanied by a sensation of not emptiness when you finish going to the bathroom, right?
Yeah, that's right, doctor.
Okay. So, summarizing all the symptoms and the familiar history of ulcerative colitis from your dad and the findings on your physical exam, I will have to write you an order for you to get a plain abdominal x-ray done, okay?
Okay, that the reason why is because of my symptoms and also because of the disease of my parent.
Right. I need an x-ray in order to see what's going on inside your intestines, well, your abdominal cavity. I need to know if there's any kind of inflammation, if there's any kind of lesion, if you have maybe air or any disruption of your abdominal wall or your intestines. I need to have an x-ray done in order to know that.
Okay, I have some doubts. So do I have to eat something or I need to go fasting?
Yeah, that's a really good question. And yes, there are some other imaging processes that you need to go on a fast. But in this case, in an x-ray, you don't need any precaution. You can drink, eat, or you can have your normal life and you don't need to have any precaution. The only thing that will happen when you get to the laboratory is that you will need to take off your clothes, and you will also need to take off any metal, your earrings, any collar or necklace. You will have to take out your glasses, and your phone will not be with you in the x-ray taking. Well, any other metal accessory that you have with you. And the sole recommendation that I will give you is, you didn't tell me that you take any bismuth medications, but if while you get the x-ray you have any abdominal discomfort, do not take any bismuth medications such as Pepto-Bismol, because it can have we can get the image go a little blurry, so don't take any of those medications, okay?
Okay.
Right, so I'll see you when you get your results.
Thank you, doctor.
I'm going. Hi Sandra, welcome.
Hi, doctor. Good afternoon.
Good afternoon. I'm glad you're back. So let me just have your history right here. Okay, so we have some x-ray going on, right? Okay, so do you have the results with you?
Yeah, I already have it. So.
Okay, can I see them?
Yep.
Okay. I'm gonna put them right here, okay?
Yeah.
Okay, so before we begin, do you have any doubt with the x-ray process going on? Did you have any discomfort in the lab, anything like that?
No, it was comfortable. I
Okay.
thought it was going to be like stressful, but it was okay.
Okay, right. So in order for you to also understand a little bit of what is going on here, I'm sure you noticed that the x-ray machine was directly to your abdomen, right? So what this machine does is that it launches a beam of radiation, and this radiation can get through or not, depending on the tissue that it has in front of it. In this case, this most likely brilliant tissue are your bones,
Oh, okay.
and
This one?
yeah, exactly those ones. And the other tissues are, in this case, your abdomen. What we can see in that image is we can see these little, well, not little, these black structures. And in this case, what I would, well, what I can see is a thickening of your abdominal wall of your intestines. The wall of your intestines is thickened.
So it's bigger than
Yes, it's bigger than normal. That means that the tissues of your colon are well swollen and are ongoing inflammation. And this can explain why you have this abdominal discomfort, and also could explain the diarrhea that you have. So in this case, if you think of liquid trying to go into a very strict or with a narrow diameter tube, well, it will have trouble passing on that tube, right?
Okay.
And second, we have this like clinical sign that are these like little protrusions here. This like a tongue print, like a tongue print.
Like.
Yes, exactly,
Okay.
like inwards.
Okay.
This happens because of the folds of the colon. Our colon normally has like these folds in order to propulse the feces. So they, as the same thing that I told you, they become swollen because of the inflammation, and they can't really press that feces like in a normal physiological way. So these are pathognomonic, and this word means that it is diagnostic of irritable bowel disease. Okay, so this also can explain why before going to the bathroom you feel like this sensation of not evacuating all the things that you had to evacuate. Okay, and yes, so this X-ray can explain all your symptoms, and fortunately, this way we can have like a therapeutic. We can have a therapeutic focus in order to treat the disease that you are having right now. So yes, with this image, and I think we don't have any more. We don't need any more diagnostic imaging. I can diagnose to you this irritable bowel disease. That is, unfortunately, right now the medicine doesn't know the exact mechanism why it's caused, but it is known that it's your own immune system attacks your intestine. It is think that it could be caused by bacteria, maybe by molecular pattern that has been hereditary, in this case by your father. And well, the next step will have to be to control that inflammation in order for you to not have the symptoms of diarrhea, of abdominal pain, and in this case, to give you a better quality of life.
Okay, doctor, what a relief, because I thought I have the same disease as my father, and you clarified all. So you will tell me if I have to stop eating some fruits or something like that.
Yes, well, right now you can take your exam, and right now we will just discuss the medicine that I will have to prescribe to you, and all the other things that you will have to consider, like in your habits, your eating habits, also your exercise habits, and your water intake. We'll have to discuss all of things, right? But do you have any questions about the exam, the X-ray, or the diagnosis that I'm giving you?
No, not really,
Any?
doctor.
Okay, thank you. So let's get to the treatment.